Have you ever heard of chikungunya? If you haven't, you might want to pay close attention now because it's a virus spreading fast across southern China. Authorities have been fighting the mosquito-borne virus with drones, nets, and fines. Heavy rains and high temperatures have worsened the crisis, and the virus travels. Taiwan just reported its first case of 2025. China has reported 8,000 cases in recent weeks. Symptoms of the virus include high fever, rashes, headache, and nausea lasting up to a week, with muscle pain that can last for many weeks. According to the European Center for Disease Prevention and Control, about 240,000 chikungunya cases and 90 related deaths have been reported globally this year, spread across countries and territories in the Americas, Africa, Asia, and Europe. Let's talk about this with Dr. Krutika Kuppalli. She specializes in infectious diseases at the University of Texas Southwestern Medical Center. Welcome to DW. Now, what are your concerns as you watch this virus spread?
Sure, I think that's a great question. So chikungunya is seeing a sharp global resurgence. There's been over 240,000 cases so far in 2025. We see it affecting numerous countries around the world. And I think the thing that's concerning is about this particular outbreak is the expanding reach of the mosquitoes that transmit the virus. It's now establishing themselves in places that previously did not sustain transmission. And so this puts more people at risk for the infection, especially those who do not have prior immunity. And it's not just the immediate illness, but also the long-term morbidity and mortality that can have an impact on social and the economy.
Why are we seeing this virus and specifically the mosquito that spreads it in parts of the world that we hadn't seen it before?
Yeah, so it's for a number of reasons. So number one, the change in the ecology is happening. So the mosquitoes thrive in environments where they can breed in small amounts of water. We're seeing changes in that due to the changes in climate. People are also traveling more so they can carry the virus into new areas where the mosquitoes that are competent are present. And then, like I said earlier, the warmer temperatures accelerate mosquito breeding and viral replication within mosquitoes, which also expands their geographic range.
This is likely the largest outbreak China has ever seen. Why is the virus spreading so quickly there specifically?
Well, I think, again, for a lot of the reasons I mentioned, I think the change in climate, you've got populations that live close together. You have this change in the mosquito ecology. So all of them are coming together to present a ripe situation for this to happen.
How dangerous is an infection?
Well, so I think that while chikungunya is not usually fatal, as you mentioned, there are deaths that are reported. The biggest concern is that it can cause severe disease, particularly in newborns, older adults, and people who already have underlying comorbidities. While most people will recover, the long-term morbidity related to the infection, such as prolonged joint pain and fatigue, can be extremely disabling and affect quality of life.
Cases have been documented now on 4 continents. Is this the next pandemic?
I wouldn't say it's the next pandemic, but I definitely think it is an infection that we need to look out for and be concerned about. If people remember, a few years ago, we had a large Zika outbreak that had significant morbidity and mortality, and chikungunya is similar in many ways to the Zika virus. And so we do need to be vigilant about it and think about how we can prepare and reduce the risk of communities that may be at risk.
Let's talk about that because China is going all out in its effort to curb the spread. What can communities do to prepare or maybe even fend off the virus altogether?
Yeah, so there are a number of things that communities can do. They can be proactive. So one of the things that can be done is eliminating standing water. This is how mosquitoes breed. And so if mosquitoes can't breed, they can't go on to transmit the virus. Also protecting yourself from the virus. So using window screens and bed nets and mosquito repellents, as well as wearing long sleeve shirts and pants, especially during the peak hours of when you might be bitten by the mosquito. Communities can also increase surveillance systems so they can detect and respond to cases quickly. And then most importantly is educating the public and communities on symptoms to be aware of and how they can prevent and manage the symptoms.
That's Dr. Krutika Kuppalli of the University of Texas. Thanks a lot, doctor.
Thank you.
Let's get some insight now from Dr. Carolina Geadas, an infectious disease physician at Brigham and Women's Hospital at Harvard Medical School. Good to have you with us. Now, chikungunya has never been established in mainland China before. So what do these latest developments tell you?
Thank you for having me. That is correct. Chikungunya is not new to the world, but is new to this region of China, and certainly at this scale. And so one thing that worries me is that this is a community that has not seen this infection, and so the levels of immunity are very low. This is a virus that spreads, thrives really in urban settings, and especially where stagnant water exists. And so once the mosquito arrives in areas with these characteristics, with dense populations, then it's really ideal breeding habitats. And so I worry that with the fast pace and scale of this outbreak, that we'll see a large number of people infected. This can, of course, overwhelm health systems, and it can, of course, lead to many people experiencing the debilitating symptoms.
We've seen China adopt some aggressive measures in response. How would you assess the effectiveness of this?
Yeah, so the best prevention against chikungunya is really prevention, preventing mosquito bites. And so mosquito control is a big part of it. We've seen in this area of China with the outbreak is occurring, intense flooding and heavy monsoon season this year, which has led to widespread stagnant water. And this is part of why the mosquito has increased in the area and led to an increase in cases. And so it's part of the efforts to sort of drain stagnant water pools and, of course, mosquito control are key efforts that communities can take. Of course, there's also individual measures that everyone can take for personal protection.
Help us understand how this affects people, because some people seem to have some immunity. Is that correct?
Yeah, so there is some immunity that can be mounted once someone is repeatedly exposed to this virus. Again, when in the case that someone lives in an area where the mosquito and the virus don't typically exist, that immunity will be lower. And so that's when you're more likely to experience these symptoms. In most cases, the symptoms are mild. They can be sort of like a flu-type syndrome where most people will experience fatigue, fevers, body aches, rashes. There are cases that can lead to more severe complications. There is a hallmark of the disease that is joint pain, which can be quite debilitating and last for several weeks or months, or in some cases even years.
And I suppose one question on a lot of people's minds would be about how dangerous this virus is. So help us understand how big a threat it could pose.
Yeah. So chikungunya is rarely fatal. As I mentioned, most people will experience flu-type symptoms. This joint pain, which is really a notable symptom of this infection, can really cause very chronic joint pain, just like arthritis. And it can be so debilitating as to make people bedbound and miss many days of work or school. There are some cases where it leads to severe complications. This can lead to bleeding. It can affect the nervous system, the heart, the kidneys, and the liver. And in some cases, it can be fatal. The risk for this is higher in populations at risk, those being the elderly and those living with chronic medical conditions.
Okay. Thank you very much for helping us get some insight on this. Infectious disease physician, Dr. Carolina Geadas. Thank you very much.
Thank you for having me.